Today is a little bit more of a laid back, what we call a lunch and learn webinar, meant to be a bite-sized, informational, no pun intended there, but just over the course of, grabbing your sandwich, getting your late afternoon coffee. By the time you're on your cookie, hopefully we've shared some information around a topic. And today's topic is around hyperautomation, specifically around these top 5 use cases within healthcare. And we're going to try to keep this broad in the context of healthcare, life science, pharma, health payer, provider, even maybe some retail health. My name is Jake Thompson. I'm on our global black belt team in business applications. I'm joined today by one of our partners. And Pawan, I'd love for you to introduce yourself and say hi to the audience.
Thank you, Jake. Hello there. This is Pawan Jadhav. I'm the CEO of Lateetud. Been in the industry for a little over 20 plus years, focused on process automation. So right from business process reengineering to using software applications to automate processes, and based here in Washington, D.C. area, very close to Dulles Airport, if you guys know the area. Thank you. Looking forward to this presentation and discussion. Thanks, Jake.
Thanks, Pawan. I am looking forward to doing this one with you today. So just some logistics. We don't have a dedicated Q&A block in today's discussion. So by all means, let's make this collaborative. If you have any questions, feel free to post those in the IM window, and Pawan and myself will pause and kind of take those questions as we go. So I'm going to go ahead and go off camera, and we'll just go ahead and dive right in. And team, this is part of a series that we've been doing on hyperautomation. So just shameless plug, here's a link to a previous session that we did. The teaser trailer session was really around beyond RPA, the topic of beyond RPA. A lot of folks get into automation about, hey, how do we decrease costs, increase efficiency, launch a new business or service, or increase customer engagement, whether that's a patient or a member, but quickly hit those limits with just RPA, or find that tools or vendor are sprawling. They're not hitting those P&L targets that they thought because the bottleneck moves. Yay, we automated this task, but the bottleneck, the constraint in the process moved either upstream or downstream, so it didn't arrive at the impact that we thought it would. Addressing fears in the workforce. Folks think that robots are coming to take their jobs, so they don't engage with the automation team. Yay, we killed those time vampires in the business, but that burden that we removed in the business now is an IT governance burden. How do we figure out our long-term strategy? Not just uncovering cloud economics, but value and use, and avoiding that 40x TCO train that we're headed towards per analysts like Gartner. So we really talked about how we help folks from a holistic perspective scale automation enterprise-wide. From how do we help folks democratize with an ecosystem, using tools that are already within the Microsoft stack, modernize, using my favorite term, automation mixology. Not just everything is a nail because I have an RPA hammer, but using the right tool when. And then optimizing through process mining, migrating even legacy RPA tools, and then leveraging our Center of Excellence and how you actually set up a automation practice with Microsoft. We've been on a journey here at Microsoft, increasing the magic quadrant of our automation tool sets. This is not so much a, hey, look what Microsoft's been up to. It's more of what I find with folks is, I didn't know. I just didn't know that Microsoft was doing all this around automation. So wanted to share this with the audience as a primer today. One of my goals today, as Pawan is sharing within the context of these top 5 use cases, we have over 400,000 organizations already working with Microsoft in the context of automation. So my goal is going to be sharing some of these success stories as we go through these top 5 use cases. So let's get started. I like to think of this as where are the juicy problems within health that we can dive right in and make an impact. So with that, I'd love Pawan to introduce his organization, Lateetud, and how they've been working with Microsoft to help customers.
Thank you, Jake, and that was a very good primer to what we are going to discuss today, the top 5 use cases. And as Jake indicated, not everything is RPA, right? We have learned that, and I think we are moving towards hyperautomation. So before I jump into the use cases, I'll talk a little bit about the company, introduce the company, and then we will get into these top 5 use cases that we have outlined for you in the hyperautomation area. So Lateetud is focused on hyperautomation. That's the only thing that we do. And more importantly, we do this for healthcare and financial services. So when I say healthcare, it includes payer providers, pharma, etc. And then financial services includes banks and other financial institutions. As the name stands, and as it suggests, it stands for flexibility and freedom. That is, I have the latitude to do what I want to do. This is the mantra for us, for our customers, is that we want our customers to be free to focus on what they're supposed to do, right? So that's what we have been focused on for the last 6 years now. So we started in 2016, and since then we have grown to 110 employees with 3 locations in the US, Canada, and India. We have won several awards in this space, and one of the recent ones is that we were the finalists. So we ended up being a runners-up, one among 3,400 partners globally. So we were the Microsoft Partner of the Year 2021 in artificial intelligence category, where we used Microsoft Power Platform to help organizations during the COVID times to stand up applications that so we'll talk about a few of those applications in this call as well today. We are also ranked 155 on the fastest growing companies here in the US. So that's us. Jake, next slide. So let me set the context and give you an idea of what we are seeing in the healthcare space and why hyperautomation makes so much sense. So if you look at the graph on the left-hand side, it presents the growth. It compares the growth, physicians' growth versus the growth that is happening in administering the health. So there's so much of difference there. And as you can see, the reason for increase in cost is not because you're adding more physicians, which is what we should be doing, but it is because there is cost associated with providing healthcare is increasing tremendously. On the right-hand side, the areas where the cost is increasing is indicated. It could be it is in fraud and abuse. It could be overtreatment. It could be pricing failures and so on and so forth. Now, this clearly indicates that there is a huge potential for providers, for instance, and even pharmas to see how this entire cost within the healthcare sector can be reduced. And this is where hyperautomation comes in. The next slide indicates that slide talks more about what health plans can do to unlock almost 7 billion in operating income. So this was a study that was done by Accenture. And if you look at the areas that are indicated here, right from claims to providing member services, even provider data management, and the software aspects of performing health management, there are areas where automation can have huge impact. The top 3 areas from our perspective is claims, membership management, and even managing member services, managing customer interactions. If you look at just one example of what I'm seeing is that the one example of provider data management, this is data from CMS, and what they indicate is more than 45% of the provider data is incorrect. If you come from the payer industry and even provider industry, you will realize that how true this is, because there's so much of time and effort that is input just to correct the provider data in several locations, and one provider may be dealing with 20-25 payers. So you can imagine the kind of the scope of this problem is, and this is where hyperautomation comes in. And then with that as the context, let me jump into what exactly is hyperautomation. Many of you may be aware, but I want to set the context and bring why. Yeah, before I get into that. So this slide is one of the important slides, and I think I have talked about few of these aspects in the previous two slides. But what is important to the healthcare industry all across is data resides in silos, getting all the data together, whether it's 10 to 15 EMRs per facility. It could be data residing in not only providers, but payers and also pharma. And how do you get all of that data together has been a big challenge. Staffing has been a huge challenge, right? How do you bring the right people, and how do you provide care when these people are busy performing manual activities? So that's one of the key focus areas. And while you're doing all of this, the experience of care as well as personalized health care, these are the two demands from the patients. But not only are you taking care of this humongous cost aspect, and you have to keep reducing that, but it cannot come at the expense of providing care. And that's where the kind of technologies that we are talking about make a lot of sense. So Lateetud, we provide services in three categories. That is, we sit down with the healthcare organizations, figure out what are the processes, what tools they should be using for automating the processes, and even create a roadmap based on business cases. So we look at the processes and we figure out how should we be prioritizing, and then work with you to create that roadmap. And then in Accelerate, we actually implement that roadmap that we have created. So automate those processes, enable your teams to basically embrace Microsoft Power Platform in this instance, and also create a center of excellence around Microsoft Power Platform. And then provide managed services so that if you need us, we are there, or if you want us to support the processes, we are there, and we will continue to enable the teams if you are moving towards citizen development or areas where you want to introduce these technologies more. So with that, let me get into the use cases. Jake, you want to say something?
No, I was going to say I appreciate the background and that y'all have a focus on hyperautomation, but I'm glad that we're going here next before we unpack these top 5, because I really appreciate your approach, Pawan, from a process engineering perspective. So maybe you can just share with the team how you all tackle these problems before we get into how we solve some of these problems.
Yeah, and then this slide brings together why hyperautomation makes sense. So moving from left to right, the way you should read this diagram is moving from left to right. Any process for that matter, whether it is a claims process, whether it is enrolling a patient, whether it is collecting data and analyzing data from a pharma point of view, it always starts with information coming in via multiple channels, right? And once the information comes in, the first thing that you do is try to understand what that information is telling you, or what it's trying to indicate. And you need to extract that information so that you can act on it. If the next steps are rules-based, then you hand it over to a software robot or robotic process automation. But if it is not rules-based, then you bring human in the loop through a workflow. And all of this is generating tons of data. Documents are being generated. So you need document management, you need reporting, you need business rules that are driving it. And all of this should be orchestrated by a digital process orchestration technology. And then you can use APIs as well where needed if connecting technologies is one of the key areas. So there are 4 major areas that you're seeing here in this digital operating model. One is data extraction, second is RPA, third is human in the loop workflow orchestration, and fourth is analytics, AI, machine learning, and that area. So if you go to the next slide, this is where Microsoft Power Platform is so strong that it goes beyond RPA. So in data extraction, it provides AI Builder, Forms Recognizer, Dataverse, which stores all of that data. Robotic process automation capabilities are provided by Power Automate. Human in the loop capabilities are provided by a combination of Power Automate and Power Apps, which are nothing but user interfaces that Microsoft provides to handle multiple scenarios. So humans have to act in some application, and those applications are provided by Power Apps. The entire process can be orchestrated using Power Automate digital process flow. So the reason why we as a service provider and system integrator and software provider, we like Microsoft Power Platform is that under one umbrella, you get everything. And that's how you automate a process. You cannot just automate, you cannot force fit one technology as Jake indicated, is that RPA is not an answer to everything. And that's why we end up, we like Microsoft Power Platform. With that, let's get into the use cases. So let's talk about the first use case. And this is one of the use cases that has been so relevant in the last 2-3 years is agility. So COVID-19 hit us, right? There's just one scenario. COVID-19 hit us, but you had to create applications, end-to-end applications, where you had to serve your patients and customers. And that had to be done within weeks, right? If not even days, so that you are ready to. And this impacted almost everyone, but healthcare and financial services the most, right? So I would like to discuss one such use case, and this can be it can be a number of use cases. It can be any other use case, but this is one use case that we ended up doing for one of the very large healthcare payers. So they were faced with a challenge when U.S. federal government mandated that up to 8 OTC COVID test kits per member per month could be reimbursed and claims could be submitted. So this customer was anticipating more than 20,000 projected projected claims per day. They were if automation was not if automation was not the answer, then they were thinking of hiring close to 100 FTEs to take care of these claims. So there was a growing backlog. We implemented a hyper automation solution. I'll talk about what exactly the solution is, but it was a combination of everything that I talked about in the digital operating model slide. And the outcome was amazing. It was a completely enterprise scale solution, which could scale up and down. The volume was no longer a factor. Over 80% of the claims were automated. We ended up saving more than 100 FTE savings. It automatically also triggered communication, emails, notification via Teams, and so on and so forth, so that there was collaboration happening all throughout. And more importantly, this was a no-code solution which could be deployed within weeks. The next slide, I talk about the technologies that were used. So if you so the claims, it doesn't matter what claims. So there's just one example, but the claims could come in from any of the channels. It could be an email, it could be a folder that we were reading, or it could be any other channel. Power Automate picks up those claims. There is a template that is already built to understand what the claims data is telling. So there was a particular form that the patients were supposed to fill, or the members were supposed to fill. So Power Automate used form recognizer to extract the data. The data was stored in Dataverse tables, and there was a correction engine also, or correction station that was provided. So if this was not straight through processed, that is, there is for some reason the data was not extracted, then there was a correction station where the employee could review the data and correct the data and then submit for further automation. And Power Automate RPA picked this data and put it into the claim system. And all that data is available in Dataverse, and we ended up using Power BI to create dashboards and also measure process metrics so that we can provide data on what further could be improved. So if you look at, so there's the couple of screenshots in the next slide, Jake. So if you look at those screenshots, it gives you an idea of what this is. So what you're looking at is a model-driven app, right? So at the top, you're seeing various stages that it is going through. There are various parties that can perform. So this is the correction station, where on the left-hand side, you see the form that is being submitted. You can look at the quality of the form. It's fairly poor, but the data is extracted. It also gives confidence levels. It gives the data that was extracted, and there is an ability to update the data as well as click and point the data so that you can review the data. So there's a complete case management system that is backing this. This is a no-code solution, completely configurable. There is a review pane that provides the capability to review the data, and it works with Microsoft Cloud and all the other Microsoft 365 collaboration tools, employee productivity tools that are provided by Microsoft. Jake, anything you would like to add here?
Pawan, as you've been describing this to our audience, what I find interesting is that you're not talking about a specific tool. You constantly are referring to this ecosystem of tools. You're almost not even delineating between, okay, here's the app, here's the automation. It's bringing all of it together to drive a solution to the problem.
I completely, and this is so important because we have worked with so many customers in the last few years, and every time what happens is you automate something with RPA, and then you come to a dead end because it needs workflow, because it needs further data extraction. If you have to automate more processes, because it also needs a customer front end, and all of this, then you are in that search to find a tool that can provide that, or multiple tools that can provide that. And that becomes another challenge: is how do you train employees? How do you acquire these tool sets? How do you license these tool sets, and the cost associated with it? So yes, I think this is that ecosystem of tools that you're referring to.
Great, Pawan. And just to add some additional color to this, we saw the same thing over the last couple of years, and it wasn't just pandemic related. I think we saw a lot of agility in our organizations to spin up apps and automation very quickly to address some of those challenges that were coming in overnight, if not hour by hour. But even, for example, when the Kronos application, the timekeeping application went down, a lot of our customers were able to quickly get back on track by launching something very fast. And what we're seeing now is this is continued into, okay, now that we've proven we can be this agile and flexible and adaptable, now folks are looking at these automations and low-code app development platforms as the agility layer over core systems like an SAP, like your EHR, like Epic, or Cerner or Allscript, over a Payor CAP system like Facet. So now we can be agile over perhaps monolithic sources of truth within our organization. And two examples I'll share in the chat window as Pawan moves on to the next topic around Seattle Visiting Nurse Association, how they quickly spun up a vaccine delivery process. And also for our Pharma Life Science Health Solution audience, Novo Nordisk that did a great interview around how they were managing clinical trials and quickly build a solution around that during the pandemic. So I'll share those customer stories in the window as you want to move forward, Pawan, into, I think, what resonates with everybody. We have some sort of paper or fax or PDF or flat file document that we need to extract that data from and draw insights and act on.
Yeah, and this is one of the use cases that is almost a constant in automation, is how do you extract information from incoming documents? And I'll in fact increase the scope, not only documents, but what about voice, right? What about video? What about images? What about emails that are coming in, right? So what we have done is we have, in partnership with Microsoft offers a lot of capabilities in all these areas to extract information. So we have developed a solution which is generic enough to extract any kind of information. But here in this case, I'm going to be talking about one specific scenario where we used a purpose-built text analytics solution that Microsoft has created called as Microsoft Healthcare Text Analytics for Healthcare, that extracts information from doctor's notes, discharge summaries, clinical documents, electronic health records, because most of this data is unstructured and it is in a specific context. It is in context of providing healthcare for certain diseases and so on and so forth. So it's a very specialized way of extraction. So the challenge that companies have, and this is across payer, provider, as well as pharma industries, is how do you understand the data that resides in the trove of these documents that are existing in EMRs and what goes through the entire healthcare process. It is very difficult to extract this information because it is unstructured. It is very costly to extract this information because now your healthcare providers who are reviewing the data are looking for information in hundreds of pages of documents to take the necessary decision, whether it is scheduling a patient, whether it is looking at the efficacy of a drug, right? So this manual data lookup is very expensive and it's very complicated. And more importantly, this causes delay in providing care, right? Whether it's in immediate care or creating drugs which can help solve problems for the society. I think these are the challenges that are presented in understanding this data. So the solution that we are working with one of the largest providers is to create a hyper automation which is powered by AI and specialized models that are created to extract this information. So the outcome is that it's a NLP based data extraction, but it goes beyond NLP. It is just not natural language, because I talked about the context. The context is very important here. There is a review pane to review all the medical data. It is a complete case management system, again, provides improved and expedited medical care. The data is made available, and this is one of the most important aspects, is data is made available for analytics and optimization. So whether it's a pharma, payer, or provider, one of the key things that you're looking at is, once the care is provided, how effective the care is. Are you seeing any trends? Or you're looking for certain types of data in certain types of or certain groups of patients? Then this data is available in Dataverse to do all kinds of analytics and research, right? And more importantly, your providers are supposed to focus on care. They're not supposed to be wasting their time going through hundreds of pages of documents. So the next slide talks about the various components of the solution. So this intelligent data processing solution, which is a generic solution that we have created, which can extract information from any documents, is the medical records come in. Again, there are specialized models that can be used. Here we have used Microsoft Analytics for healthcare, which extracts the data, stores it in Dataverse. We are using, in this solution, we are using SharePoint plus Syntex combination for document management, because there are lots of documents that will be coming in. So you'll need a document management system, but it can integrate with any other document management system if you're using anything else. But Syntex, if you have kept your eyes and ears open, there was some very good announcements that were made in the last few months and a year. So it's taking SharePoint to the next level. And if there is any patient data that exists within your core healthcare systems or dynamics, even that can be brought in for verification of patients and the PHI related information. And then Power Automate can be used to update any of the systems internally or externally. So the RPA capability of Power Automate can be used. Another key aspect is that when you extract this information, for instance, you have 5 or 6 categories of medical records. It could be a referral, it could be a prescription, it could be the medical notes, and so on and so forth. There is once the data is extracted, it has to be put into different queues so that the staff on your side can review it and different departments can review it. And that is where the model-driven capability of Power Platform comes in, which can then where you can create workflows so that everyone can participate and make sure that it sees its logical end in this area. And then all of this data is generated. You can definitely create data lakes, and you can use Azure capabilities to review and analyze the data. But Power BI can help you in reporting and creating dashboards and measuring process metrics and so on and so forth. So the next slide talks about the key features and also shows a glimpse of what you're looking at here. So the data extraction that is performed also has the ability to highlight, annotate, summarize data. On the right-hand side, you're seeing the PHI information. So there are categories of information that will be presented to you or the user to review the data. So instead of going through line by line and trying to figure out where things are, there are things that are presented which make sense, right? And as I indicated to you, you can combine this with model-driven apps. You can. It is a complete case management system which helps you in streamlining this entire medical records data extraction process.
Juan, you kind of hinted at this in the last, top 5, where you showed the very grainy looking document, and a lot of announcements I think we've made lately. We can handle all types of formats and languages and even handwriting. So I think there aren't any limits in that category. And in fact, this has been such a popular use case, such a popular topic. We'll have a slide on this towards the end, but we've actually at Microsoft with partners like Lateetud just put together a document automation starter kit. We've woven intelligent document automation into the Power Automate Studio and the tool for teams to quickly get stood up. But we've actually got a complete automation starter kit around this. And another, customer evidence that I'll paste in the window here. U.S. Acute Care Solutions, they're doing this. 20 million medical records being processed annually with Power Automate RPA. So I'll put that customer story in the window for folks as we start to make sure we get done before everybody moves on to their cookie part of their lunch of this lunch and learn. But Pawan, anything else you want to add in this topic, or do you want to move on to the next one?
Just one aspect of it, right? Jake, you talked about 20 million medical records, and medical records can be of different categories. So the beauty of the solution that and the tool set that Microsoft offers is that you can categorize and tag these documents automatically. Once we have figured out what type of documents are coming in, AI helps us do that. And that's a very powerful feature combined with the intelligent data processing solution that we are presenting here. With that, let's go to the next use case, shared services. So this is one of the areas where this impacts almost every industry. It impacts every company. So I'm talking about shared services like finance, IT, HR, and I'll talk about one specific use case, which is employee onboarding and offboarding. But again, this is where the existing capabilities of Microsoft Active Directory, security, and cloud, and so on and so forth, combined with Microsoft Power Platform, can help you solve a lot of these challenges. So let me talk about one specific use case in the next slide, Jake. So this is employee onboarding, offboarding solution. I realized that, and this is, we have talked to several companies now, we're working with a couple of them where we have implemented the solution, is the challenge of getting something off the shelf. There are off the shelf onboarding, offboarding solutions, including identity access management, which helps in provisioning systems for new hires. But the companies faced a challenge of customizing it, and it did not meet their needs. And we are seeing this time and again that the off-the-shelf products do not work. So the extensible nature of what Microsoft provides helps you solve this challenge. Right, so the challenge that you face when you're onboarding and offboarding employees, this could also be extended to onboarding, offboarding vendors, by the way. Right, the process is very inconsistent. Lots of documents come into play, but again, how do you provide roles-based access and how do you control access also becomes a security and compliance issue. It's a very manual process. There is no there is no end-to-end visibility. You also lose productivity because in a large organization, when you're talking about clearing various hurdles and at the end of the day, giving access to dozens of applications, it's a fairly manual process of provisioning systems, and it is also error prone, right? And then and this again repeats itself when you're offboarding an employee. Right, you have to timely offboard the employee. You also have to make sure that all access is shut off, and many a times it's a very manual process to get that done. The solution here again is Hyperautomation. If it the Hyperautomation solution that talks to your internal, if you're using Dynamics for your HR activities or any other HR tool out there, whether it's Workday or any other ERP system, it talks to the systems, but then the entire workflow is automated using various aspects of the digital operating model that I talked about. Provides end-to-end visibility. You have complete idea of where the access is and where it stands and why is it failing. Improves employee productivity because now instead of taking days, it could be completed within maybe an hour, right? So the employee is productive right away. It's but more importantly, it also gives a very good experience to a new hire that is joining, so that not going through lots of hurdles to get access and get provision. It's a consistent process and reduces all the manual effort that is required there. So let's talk about what the solution does. We have used almost all the things that I have talked about previously. Is The HR initiates the case. So this is a case management system again. We have used model-driven apps. So the case is created within a model-driven app that is powered in Power Platform. And then there are three key players in the entire workflow. There is the HR manager, the hiring manager, and the provisioner, typically someone in IT who is provisioning the systems for this new hire. So the HR initiates the case, the hiring manager and provisioner act within the business process flow defined in Power Automate. So if there are changes to be made, if there are updates to be made, or if the things have to be approved, all can be done within a case management workflow system. There are predefined rules which govern the role and title based access. So it interacts with Active Directory, and you can define if a person is joining certain department in a certain role, then what access the person should have and what systems the access should be provided. Everything is predefined. And Power Automate, that is the RPA part of Power Platform, is the one that provisions and deprovisions these systems. So creating the user ID, assigning the password, providing the right kind of access, and even deprovisioning is all done through robotic process automation. And all this while it is generating data, so you can always, as I've indicated previously as well, use Power BI to measure the process metrics. So I come from a process side of things, so it is always important for us is first of all define the process, make sure the process is being followed, and then you improve the process. Those are the three major aspects of process, right? And when you're defining the process, you're trying to figure out what are the non-value adding steps that you're taking that can be automated, right? People should be performing steps which are value adding, and that's where this entire framework of using these capabilities to meet those three objectives is very, very critical. The next slide talks about the features, gives you a glimpse of what you're seeing there. Again, a model-driven app, as you can see. When I say model-driven app, it is a workflow-driven where multiple parties are acting within the workflow. There are predefined configurations, as you are seeing. These configurations can be changed, and it's a complete case management system which provides entire tracking from start to finish.
Yep, Pawan, there is so much that I think there's so much opportunity in these shared services like you identified within finance, HR, even perhaps supply chain. It could be as straightforward as, wow, can you just take some of these W-9 verifications off of our plate? Or it could be more around, hey, we're doing a ton of M&A activities and we want to automate the heck out of those back end processes. The customer story I'll share in the IM window, and then we'll move on to the next section because I want to make sure we have time for the last two use cases here. Kind of overlaps with shared services as well as that agility layer. Our partner EY, I think a lot of us can probably may have used this tool even with employee mobility. They had to build something within 6 weeks because now we've got to track changes and coordinate changes in tax status and compensation and migration. So a lot of that's been changing over the last couple of years, and EY had to move very quickly. So I'll post that in the IM window from a customer evidence perspective, but we probably need to get on to the next section here around contact center AI.
Yep, and contact center AI is emerging as a big use case, and the reason is that there are agents who are taking the calls, but there is so much of scope for deflecting the calls, again, to increase customer satisfaction, also to perform back-end work and help the agents resolve the calls faster so that your first call resolution increases. But all of this is where you bring the capabilities that Dynamics provides and also Power Platform and other employee collaboration tools like Teams and the recent acquisition of Nuance, where all of these come together to create an ecosystem that helps run very efficient call centers. Right. So this particular use case I'll talk about, and let's go to the next slide, Jake. So here in this context, I'm taking member enrollment. The challenge that one of our customers faced is that the member enrollment, even member updates and queries and so on and so forth was part of this, where very long calls where sometimes the calls drop and the entire context is lost. A lot of manual activity. Single pane view was available in certain areas, the other areas it was not available. So we created we are creating a solution which brings together the CRM plus Power Platform to help alleviate these challenges. So I'll talk about specific technologies, but the benefits and the outcome was there is a single pane view which is provided by Dynamics 365. There is Power Automate that is helping in assisting the agents to resolve these cases faster, whether it's updating internal systems or getting data from internal systems so that the data is available in one particular place. And then there is IVR and AI sitting right up front, which can help resolve many of the challenges which should not be even taken care by a live agent, right? Which helps both customers as well as both the patients, members, as well as the customers to reduce the cost of providing care, and it expedites that care as well. So the next slide talks about the technologies that are being used here. So I have divided that into three categories there, three areas. So the first area that you see there is the front end where you're interacting with the customers. So the Power Virtual Agents and Intelligent IVR, which is provided by Nuance, takes care of that conversation AI, right? Where automatically things get resolved and the context is set and the customers get personalized care. The calls that land in the contact center and where a live agent has to address the query or the question or the case, that's where the Dynamics 365 customer service module comes in. It could be any other CRM that you have, so you can still use Power Platform. You can still use Nuance IVR and gatekeeper features, which basically is used for authentication without Dynamics 365. But within Dynamics itself, there are so many cool features. So Smart Assist is one of the features that helps resolve these calls faster by providing the help when it is needed. Using knowledge base articles and so on and so forth. Customer insights enable bringing that 365-degree view of a customer. Sentiment analysis helps in customer engagement in real time by figuring out what sentiment is being seen in the way the customer is interacting with the agent, so that the agent can address that aspect well. And then agents can collaborate via Teams with other agents or supervisors. Where the supervisors and teams can actually see the conversation that the agent is having with the member and the customer. So and the Power Automate, you see the back-end fulfillment and the agent desktop. So whether it's assisted or unassisted portion of the automation can be performed by RPA. The last slide talks about the features. So you see a couple of screenshots on the left-hand side, which is Dynamics 365 bringing all these capabilities together, and engagement across. So why this is so exciting is that you can have engagement across multiple channels, including authentication and conversation AI. There is intelligent routing through automated context gathering. So right when the customer is calling in, authenticating the customer, and based on the type of call that is, it is intelligently routed to an agent that is available and has the right skills to resolve the use case. It has a complete case management system built into it, and there's a complete visibility of what is happening. You have customer insights that come into play. So there's some great features available here. What we feel is that the member services area, which, as I had indicated in my first slide that I presented, that there is almost $1 billion plus cost that can be saved in member services itself. And this, when combined with Microsoft Power Platform, can help you get there. Anything, Jake, from your side?
I think for our audience, the public service announcement that I would add is we're showing a lot of these solutions being solved with almost holistic Microsoft tools. We get it. There's already tools within customer environments. So I think the only thing I'd mention at this juncture is we have 800 plus out of the box connectors as part of the automation studio to connect with existing systems, with existing solutions within our customers' already existing portfolio. And we can even augment that with custom connectors or on-prem connections. Obviously, RPA is that kind of user interface ultimate connector. So this can work in a modular fashion with the existing stack. But Pawan, I want to make sure you have enough time in the next 10 minutes to land on the last use case, which I'm excited about. But by way of customer evidence to share with our audience, this is a payer use case, and it probably wouldn't take much to imagine this in a provider scenario as well. But I also want to highlight a life science solution with Patterson Veterinary, and I'll chat that here in the window, and how they did something very similar to this that ended up saving an hour a day for their 1,300 core CSR agents. And just imagine if anybody's living in that call center universe on the call today here or listening to the recording, an hour a day in your call center with your CSRs, imagine what they could do with that time and that empathy. So Pawan, in the remaining time that we have left, let's see if we can squeeze in workflow orchestration. I think this has been more of a full course meal, lunch and learn, but we have about 10 minutes left, my friend.
Yeah, so I think this is the last use case and one of the most important ones, workflow orchestration. In almost every case, there will be multiple people who would want to be part of a process. The process has to be orchestrated where you bring people, process, and technology together. It is not always about people. It is also about bringing all these three aspects together. And many a times it is not as straightforward. It is complex. It is going back and forth. It is building an entire workflow that takes care of it. And this is where, again, Microsoft Power Platform shines. I'm going to present one use case, which is specifically targeted towards onboarding providers, right? Provider enrollment. So the challenge here is that 85% of credentialing applications, so if you're bringing a provider that is a doctor or a nurse, right? 85% of credentialing applications have missed or wrong information. 20 to 25 average number of payers a typical provider is enrolled with. So you can imagine how you have to submit data to 20 to 25 payers for each of the providers that you are enrolling. $9,800 of net revenue loss for 1 day delay in provider onboarding. And how many days does it take? It takes 120 to 150 average number of days is required to enroll a provider. So you can imagine on one side, we are facing challenge of getting the providers started and having enough providers. And on the other side, we have this challenge of even if you have a provider, you're dealing with this difficult and complex process. So the solution again is hyperautomation, where you bring several aspects of what Microsoft provides to help you solve this challenge. And again, as Jake indicated, is that everything is modular, by the way, right? There are certain aspects that you may already have, but there are other aspects that you can pick and choose from the extensible and modular nature of the ecosystem that Microsoft has created. So the outcome is the time to enroll and even check the licenses and credentialing is reduced drastically. And the end result is that you have accelerated patient care. There is increased revenue capture, right? So that's not the ultimate intention, but at the end of the day, this is a private enterprise, and there is a financial viability aspect that you have to take care of. So there is increased revenue capture that you are able to achieve. More importantly, it reduces the load on the credentialing staff, where staffing is a huge challenge in every industry. You do not want to add tasks and work that doesn't add any value. So if you go to the next slide, there are three key actors in the process. There is HR that initiates the case in Power Apps. There is provider that is providing all the related information so that the provider can be onboarded. And the hospital staff is responsible to run this entire process, do the credentialing, submit for enrollment with the payers, and so on and so forth. So the model-driven app, which is provided by Power App, does the entire case management. The data is stored in Dataverse. If you're using Dynamics or any other ERP, you can bring the data in so that you can add and enhance the data, or you can update the records as well. And Power Automate is used in two aspects. One is bringing the data from three aspects, by the way. One is bringing the data from internal systems. The second is checking the licenses on state websites. So each of the doctors, you have to verify whether the license is active and if the person is licensed to do business and provide care within a particular territory. So that aspect can be checked by the RPA. So RPA can log into these websites and get that confirmation. And then RPA can also submit the information to various payers once all that check and validation is performed. And this system is also used for updating and keeping the status active for each of these providers on a regular basis. So that this is also used for monitoring and updating. So next slide talks about or gives you an idea of the kind of workflow that we're dealing with here. So there are various swim lanes that you can see at the top. That's where the process orchestration is happening. So there is the provider, there's hospital, and there is credentialing staff. And at the bottom, you see the external entities like states and payers, where the RPA is going and checking the licenses, submitting for enrollment with the payers, and also collecting data that can be shared later. And you can establish connectivity with CAQH as well. So it provides all the different features that I talked about, right? From accelerating the entire collection of documents and collecting information, provides a complete workflow so that it is tracked end to end. And all of this data can be again reported, and dashboards can be provided using Power BI.
Juan, thanks for sharing this use case. And for our audience, two other customer stories that I'll chat in the window here. One from a provider perspective, our customer Vitas. They did something similar in this workflow acceleration, how they automated care coordination, like real-time scheduling or patient status visibility. And in their words, it improved the working experience for the clinicians so that they could allow them to provide a higher level of care. And then for anybody that might be in the audience from our retail health, I want to share a customer story around Walgreens and how they did a workflow optimization around their store visit and audit app. And they actually reduced store visit time from 3 to 4 hours down to 60 to 90 minutes. Juan, we're almost at the end of time. I'll post those stories in the window for our audience, but for anybody that wants to get started with your team, can you kind of share how your team kind of approaches, first meetings, et cetera?
Yeah, the first and foremost that every customer asks us is, what are the processes that we can automate? So you saw the top 5 use cases, so it gives you an idea of what you can automate in each of those categories. But then looking at your processes, your specific processes, and figuring out what components of this extensible ecosystem that Microsoft has created can be used, and what is the benefit that you can see, and how to create that business case, whether it's a small business case for a pilot where you want to identify the first 3 to 5 processes, or creating a big business case subsequently where you are creating a roadmap for next 18 to 24 months, which also includes enablement, is all that we can provide through our process advisory function. So I think the next step from my perspective would be, apart from several other things that Jake is going to present, is let's look at the first top 5 use cases in your department and maybe choose a couple of them to do a pilot.
And Pawan, I have to ask, what is this comment about crab cakes?
just want to indicate or give some indication of this particular customer where it is based, right? So I'm not going to take the names, but you guys can figure it out.
All right. Well, it's definitely a lunch and learn now. And for our audience, from a Microsoft perspective, I mentioned kind of these building blocks. From a democratized perspective, we offer RPA in a day, Power Virtual Agent, PVA in a day training. We have an automation tool quiz. If you're just trying to figure out what tool win, that link can be provided. If you have legacy processes, obviously our process mining tool can help identify that, but most folks have legacy RPA. We offer a migration assessment. Is it possible to move from some legacy RPA tool into Power Automate Desktop? Is there potential savings there? We have a white paper around HEAT, which is an acronym for Holistic Enterprise Automation Technique. basically just our point of view from our PowerCat team, our customer assistance team on how do we help folks scale this enterprise-wide, not just pockets of impact, but impact enterprise-wide. And I mentioned this earlier, document automation is such a hot topic. We could just easily start there. So we have a starter kit ready to go for our customers, and please feel free to ask your Microsoft resources about any of those. If you just want to, dig in deeper, self-learning on Microsoft Learn, our doc site, certifications are available. We actually just made an announcement just yesterday with Project Management Institute, PMI, and Microsoft for students that want to start learning low-code app dev and automation while they're still in school so that they graduate into the workforce with that certification. Large growing community around folks building automations within the Microsoft ecosystem. So plenty of ways to connect with the broader audience. We mentioned a lot of business outcomes around savings and financial impact. But at the end of the day, we always want to remember that this is about up-leveling humans. We really want robots to do the automation work, and we want people to have time for empathy and the stuff that only humans can do in healthcare, which is just such an important mission and endeavor. And we thank you, everyone, for joining today, the folks that listen to the recording, all of you in healthcare, taking care of our communities. Thank you, thank you, thank you.